Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 9 of the podcast. Today is March 2nd, and here we are, a brand new month and the start of a new week. I just can't believe how fast this year is going by. And I am super excited for today's episode because we have a special guest that is going to join us, and our guest is a highly successful coding entrepreneur, and she has completely changed my life. So to have her here today on the air with you is such an honor and a privilege. And we're going to talk about a monumental change that is coming to the healthcare industry in just 10 short months, and what you need to do to make sure your organization can comply with these new regulations. This is epic. Before we dive into our interview, it's time for your Monday dose of positivity, the Mindset Monday tip. And it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering $100 off the Certified Risk Adjustment Coding Prep course when you order through our website. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. Our Mindset Monday tip is all about strength, and I know I posted on social media about this during the week, but this quote really resonated with me, and so I wanted to share it with you. The quote is, "A river cuts through a rock, not because of its power, but its persistence." And I think this quote is just so powerful because persistence is a crucial part of success. And I think a lot of times we see people that are already successful and we just think, oh yeah, it must have been so easy for them and here they are. And that's not the case. Persistence and showing up for yourself is critical. And if you look at every single river that exists on this planet, you see that it exists because the water was persistent, not because it was powerful, but persistent. So keep this in mind as you go about your day and you navigate your challenges. Be persistent. Our guest for today is my mentor, business coach, and friend. Her name is Terry Fletcher, and she joins us from Laguna Beach, California. Terry is the owner of Terry Fletcher Consulting, which is a national consulting firm specializing in the business side of medicine. She is the host of the very popular Codecast podcast series, which drops new episodes every Tuesday on Terry Tuesday. Terry is an author, board member, speaker, and regular guest on industry podcasts. I invited her on the show today to discuss her best pro tips for mastering the E&M coding changes that are coming up for 2021. Thank you for joining us today, Terry.
Thank you for having me. Good morning, everyone.
Absolutely. So the 2021 E&M coding changes, they're the biggest changes the industry has seen since ICD-10 implementation. Can you break this down for our audience? What exactly is changing?
So the outpatient, or I should say office and other outpatient codes, are really what is hitting the impact of the changes. Specifically, the 99201, which is the new patient visit level 1, that will be deleted in 2021, mainly because both the level 1 and the level 2 have the same straightforward medical decision making, and Medicare felt it was duplication. And remember, just to your audience, that the Medicare and AMA, the Medicare people and AMA, they work together in tandem to try to make sure that they're as close as possible to being consistent within the code pairs and code sets and coding rules and regulations. The reason they do that is just to make sure that you don't have too much disparity when going back and forth to payers. And so what is helpful is that they both have really worked together to try to make these changes plausible for all payers. But you are going to see that there are going to be some payers out there that are not going to be on board with the complete changes. For example, workers' compensation. I've already been told in some states that they're going to keep the level 1. So if you are an orthopedic practice or a primary care practice, that could impact you. Just make sure that you are checking the different payers on what they're going to do. The next thing would be the documentation efforts. So when it comes to auditing right now, and that's how I kind of roll it back to how do you know where the changes are? As an auditor, and I know Toni, you also also audit records too for a living. That's a branch of, our business, that what we do. It's kind of something we fell into, basically. Once we start educating and speaking on topics, then people say, can you take a look at this? And then it kind of snowballs from there. But the auditing perspective is that you won't score anything from a history and physical exam perspective. It's really going to focus either on time or on the medical decision-making process. And so, in just really keeping in that theme, that's going to be where the kind of the concentration is for the biggest changes. And even language is going to change on medical decision-making. It's not going to be the same as how we know it now. Similar, but not the same.
That's a really good summary of the changes. And I like that you emphasize the variations with the work comp payers and just really having an idea of what everyone's going to do.
Yeah, it's really going to be tough because right now, as everybody is heading into EMRs and EHRs, and it's funny that I say heading into, there might be some of your listeners that have already, obviously already got their electronic medical record and electronic health record system. But believe it or not, folks that are listening here, I just did a brief audit and education piece on a practice that is still doing paper charts. So it's not everybody has made the transition. And I don't know, Toni, if you've seen that too.
I have, yes.
Yes, but we also do a lot of legal work with depositions and things, and we get sent paper charts still, either scanned and emailed, or we all of a sudden go to our pickup place and we're like, wow, they FedExed them to us, and these are all paper, and they're not something they printed off the electronic health record. It's something you're like, yeah, this came right out of a chart, because we're still seeing some legibility issues. But when we look at this, I think it's going to be interesting because, and the reason I mention that is that some practices that haven't moved into the electronic health record or the electronic medical record, and it's interchangeable. One inpatient usually refers to it as EHR, outpatient physicians refer it to EMR. That's why I go back and forth. But if you haven't transitioned into that yet, and you're so used to templated information and you pick and choose, you cut and paste your way to good health, it's going to be different. It's going to be very subjective as we move into 2021.
Absolutely. That landscape is really changing. So what is your specific advice for coding professionals to prepare themselves for these changes?
Well, the number one thing would be educate. Okay, you're really going to have to prepare yourself is to sit down at a focused webinar, educational workshop, live seminar, whatever you work best in, whatever platform works for you. If it's hands-on, if it's independent, if it's digital, and get the materials that go with step-by-step on how you're going to proceed with this change. And it's really good that, I'm putting it in my podcast, and I'm glad you brought it up in your podcast this week, because it is, I know it's in 2021, but it's amazing how quickly, we're already getting into March. It's already 2 months out of the year has already faded away. And so if time flies, especially in the billing office, in healthcare, and education is the big thing. And speaking of that, Toni and I will be presenting a 4-part series, which we'll mention later in the podcast, on how to get ready for it, what you're looking at as far as specific details, how to self-audit yourself, and then how to level a service. So we are definitely on top of the education piece. And that's the first thing I would really look to as far as what coders should do.
Definitely. And you make a great point about, first quarter is almost come and gone, which is just crazy because it feels like we just started 2020. So putting this on your radar now is really going to pay off when end of year comes and it's just too late. Really, you need to start now. So what are your top 3 pro tips for providers to prepare themselves for these changes?
So the top 3, first of all, it would be stay up on all your Medicare bulletins. I know staff a lot of times gets that information, but you really want to have physicians also have access to that. So they can get it from their association. Their association is their lobbying voice. So they need to, I know a lot of doctors say, oh yes, I'm part of the AMA, or if you're a cardiologist, I'm part of the cardiology associations, the ACC, or if you're a orthopedic physician, then you're part of the AAOS. You need to make sure that you're logging in and seeing what they have on their front page, because they'll put it on their homepage, alert, here's where we're at with this. And then the second thing I would say is truly, and this may be a shameless plug for our webinar series, but register for our webinar. Toni and I are doing a lot of research on this. We've made sure that as auditors ourselves and certified in E&M, we've made sure that we are on top of it, really understanding what Medicare is bringing forth and the AMA. That's the CPT book. And register for the webinar series. And don't just say that you need one, you need all 4, because we get into the timeline, and that's really important. And then then really what are the changes? And you need to know that because you're going to have to adjust and this is for the physicians, they're going to have to adjust their templates. Some is outpatient and then everything else. And then also just knowing how to level, etc. They're going to have to relearn it. But then the third thing would be make sure and this is a big one, make sure any random internet information you hear or read is verified by an authoritative source, or it could be inaccurate. So for the physicians that are listening or providers, even the coders who are listening on the podcast, if you find something and you're thinking, is that true? Think about it as fake news until you verify it. Just like the political climate right now. Some things are put out there and you're thinking that can't be true. And so you want to verify your information. Otherwise, you could be heading down the wrong path.
I really like your reference on the fake news because there is there's so much misinformation out there, especially on these 2021 changes.
Oh, it's crazy. I just took a free webinar just to monitor, see what was going on. And I was actually asked to do so by a company that monitors, what's going on in the web. And they gave in wrong information. They said that the nurse visit was going away, and the nurse visit is not going away, the 99211. And so I had to comment and say, back the train up, that would be incorrect. It was discussed to get rid of both the E&M established level 1 and also the new patient, but they're utilized for different things. The nurse visit is a non-physician visit, so that would still be there.
Right. Yeah. It's important to fact check and realizing what's an authoritative source. I know you've done a lot of articles on this, and Facebooking and Googling codes just doesn't work.
It really doesn't. And I know that one of the things that Toni and I have noticed in our podcasts is that we have a very large offshore audience. And so if you're out of country as well, or for those of you that use out of country or offshore billing companies to assist in your revenue cycle management, you need to get US-based information. This is a US-based update. So I can't say that enough. Hopefully I was politically correct, Toni, on that.
No, absolutely. And you make a great point, because more and more professionals are getting into this industry in other countries, which is great. We absolutely encourage that, but we want to make sure that everyone is using those compliant regulations. So what would you say to the defeated physician, the doctor that's just been around in this industry for 30 plus years? They've seen change after change, and they're just scratching their heads. They're completely perplexed as to where to even begin.
So this is funny that you put this question to me, because I've had clients that have been with me for 25 plus years, and we audit them every year. And I get a lot of the physicians are still there that I started with. And so it's a little bit amusing to me whenever they say, oh, hey, Terry, how's it going? What are they doing to us now? And so I have to, kind of back them up a little bit and say, I love you, but they're not doing anything to you. It's just things change with the times, and you have to have a checks and balance. And unfortunately, there is some administrative, roadblocks and work that's involved when it comes to proving that your services are appropriate from a billing perspective. And so, but I do feel the physician's pain. Well, the one thing that the doctors have to realize and why this is changing is the theme from Medicare. Now, I didn't see that AMA took the same position, but they're on board with it. And it is called patients over paperwork. So the Medicare people, basically, if you've heard the director talk about this, Verna, she basically was saying that their position is that physicians are spending too much time taking a full history, the HPI elements, the review systems, the full exam, and again, pasting your way to good health. And they should be spending more time with the patient. And so they feel that this is going to save them, I think I saw about 54 minutes a year, not a big windfall in my opinion, but okay. But they say this is going to save a bunch of time for the physician. But here's the thing that I find interesting. So their mentality is that this time is going to be used to sit with the patient longer, to have more face-to-face time. And what I've seen in my years in healthcare is that it's actually going to allow the physician to get an extra patient in. So I find it interesting that, that this is the concept they're looking at, but the realities of practices that have a waiting list, that it's, you can't get in for 2, 3, 4 weeks. They're going to say, wow, now I've got extra time to get in that extra patient, not necessarily spend an hour with a patient. So I appreciate what Medicare is trying to do as far as the concept, but I don't know how well it's going to work as far as the realities of a practice. practice.
Sure. Yeah. The execution is always a tough one. And I know we've talked about this many times. It's like they create these rules and they sound really good in theory, but then we see that they don't always roll out in the way that they were intended to, with the patients over paperwork theme that we've been sold.
They don't. And one good example is, remember in 2010, Medicare did away with consultation visits. They're not even on their fee schedule. They're still in the CPT book, but they're not in their fee schedule. Well, I understand why they did that because of all the abuse of what a consultation is. Currently, there is no consultative visit, and there should be. So instead of continue to educate, continue to slap hands and say, don't do that, do this, they just said, okay, we're eliminating it. You're done. So they kind of, put them on restriction or grounded them and basically said, you're not listening, so we're just not going to let you have it anymore. And I don't think that's always the way to do it. So there's some things here, just talking about the defeated physician, there are some things here that I think can be positive for the physician as far as, yes, it will ease what you have to do from a documentation standpoint, but I'm going to throw out a negative where I think there's going to be some ambiguity when it comes to, does my document today's encounter, does it support the level of service I chose? Because as an auditor myself, it's going to be really hard to know that, because I'm going to have to also enlist my subjective clinical opinion. Was this appropriate for the diagnosis that was presented?
Absolutely. Medical necessity trumps all. So what are some of the advantages of working with a seasoned consultant that can guide you through the training and implementation process versus a DIY method, which is what we see oftentimes done?
It is. Well, perfect example in a couple of the practices recently that I have gone to. A lot of times practices, even coders and, some of the, I guess the healthcare professionals, they don't know where to start. And that's where someone like Toni or myself can help you, a seasoned consultant that you trust. Okay. So it doesn't have to be us. We're not plugging ourselves, folks. We are busy enough. We're here for you if you need us, but we just want to let you know that you just, find a consultant that you trust that also participates in your specialty. That's a big one. And that, is an authoritative reference and does their homework. That's one of the things that I probably pride myself in more than anything. And that's the biggest review I get, especially when I speak at conferences, is how current I am. I know, Toni, you've attended conferences, I've attended conferences, and we both attended all kinds of coding and reimbursement and documentation workshops for revenue cycle management, for clinical documentation integrity, all of that. And it's amazing to me how dated sometimes this information is. And so I think one of the things that you really can find an advantage with a seasoned consultant that you trust is make sure that that person is updated, is current, and that they have their information from reliable sources and references.
Absolutely. And we talk about this all the time, but it's not the certifications that warrant your expertise. It's that experience combination with the credentials and all of the continuing education that you commit to. You're a lifetime learner if you're going to be a consultant, if you're going to be successful in this business.
I agree. And one of the things too is I want to put this out there, just kind of going back to what you asked me about the physician, and then also, how to prepare providers. And, if there's administrators listening to this podcast, one of the biggest things is you need to increase your budgets for this, for education. I see how much money you've put into your electronic health records, your EMRs, your practice management systems. But then when I ask a practice, how much is your budget, or what is your budget for this year for your coders, for your learning, in your central billing office? And usually they tell me $1,000 a year. And I'm like, wait, what? How many doctors do you have? How many coders do you have? And, just going to a conference is about $2,500 if you're sending them out of state. You should really allocate at least $500 per, coder or biller, and just making sure that they have at least, 2 webinars a year. Then that's just being, conservative in the approach. But not having a budget for education is going to cost you in the long run. And so that's a big deal for this update.
Absolutely. You have to invest, because this investment, I say this all the time, it's like Uber or DUI. It really makes no sense to go with the cheaper option.
I loved when you said that at one of your meetings, and just so you know, I always take Toni's little comments. I do reference her, but I just think she's funny. So she's got a great sense of humor. I get to meet her in person in March. So she cracks me up, and I'm like, oh, what did she just say? I'm using that. So when I said that to somebody, I said that comment to somebody. I said, well, think of yourself, a DUI versus an Uber. And they're like, oh, that makes perfect sense. I go, yeah, it's not mine. It's Toni Elhoms. I wish I could say it was mine.
Well, I would not be here today on the air if it wasn't for you. So I think I can give you a few punchlines.
Yeah, I think the listeners right now are like, okay, we're sitting in the middle of a hot fudge sundae. Let's move on. So what's the next question here?
What are your top 3 pro tips for mastering the E&M coding changes for 2021?
Okay, so this one I really had to think about because I also don't want to take away from what we're going to be doing from a webinar series, but I really just want to get into the heads of your listeners and really just give you a place to start. And then hopefully you'll come along with us for the ride to make sure that you are educated, implemented, and ready to go come 2021. So number 1 would be designate a project lead. The variety of tasks that's going to require attention to detail will necessitate a strong team leader. You're going to need to ensure that nothing's missed. So designate a point person to coordinate all the elements associated with these documentation changes. It should be their project baby. Number 2, allow for preparation time. With any systemic change, staff and providers need time to identify the processes that will be impacted. You're going to have workflow issues. You're going to have template issues. You're going to have to talk to your vendors. This is not just education. It's about how things are going to change in the office with some time elements that are going to lighten up as well. And you want to allow ample time for this and implementation of a newly devised workflow plan to make sure this happens. And then I would say number 3, and I kind of went back and forth on this because I also mentioned, education and things like that. I would say that probably communicate with your electronic health record vendor. Many practices, you have protocols set up in your EHR system, and that facilitates E&M code suggestions. But the upcoming changes in coding and documentation criteria is going to require rethinking this process. So it's important that you engage your vendor early this year to begin communicating about software modifications, because again, we're going to have 2 different templates we're going to have to use for outpatient and then inpatient.
Those are great pro tips, Terry. So can you tell us more about Terry Fletcher Consulting and what services you are offering to prepare organizations for these epic changes?
So I've had a lot of practices that have come to me in the last 2 years and I've been doing auditing for not just Medicare, but also in the private sector for a little over 30 years. And it's interesting because in the last probably 2 to 4 years, I've had a lot of practices that have said, can you take a look at where we're at now so we know what we're going to have to update later? Are we really meeting the criteria now, or are we passing our audit? Because remember, everybody, garbage in, garbage out. You're not going to go from not doing well in an audit to all of a sudden now doing well if you haven't perfected what's going on now, because now you're going to get to scale back a little bit, but not much, but a little bit. So what we offer is we offer auditing services where we can take a look at where you're at now, and it's a per chart service. So make sure you take a look at my website at terryfletcher.net for that. And then also education. So, and this is where, again, Toni and I are going to be doing a 4-part series, and we're going to spread it out, because think about this for a second. When you get the changes for the coming year, do you start talking to your providers about it in March for 2021? You don't, but you need to internally prepare. And so March 12th is going to be our first webinar, and that's going to be on the timeline, what you need to do, who you need to contact, and basically it's going to expand on those 3 tips for those changes. And then we have our second one on April 22nd, and this now is going to be letting you know exactly what's changing. So the final, from the proposal to the final rule, and just really defining that for you in a webinar type series. And then in July, it'll be how to level a code. Now it's going to be, teach you how to do it, and then that way you're going to know how to bring it back to your office and train your physicians. And then the last one is going to be how to self-audit. So you're going to have to look at it as soon as your physicians are trained, probably around the 4, 5, 6 month period, and say, are they doing it correctly? Because part of me, Toni, feels like this relaxation on the documentation efforts is going to be a little bit of a trap for physicians, because they're going to get to decide what is an appropriate exam in history based on the presenting problem. And I don't know. I'm just feeling like they're not going to do what Medicare feels is medically necessary. So and they haven't really given us a true definition of that yet. And so when we get that, I think that's going to be kind of an interesting concept, because it's going to change a little bit.
Absolutely. That subjectivity, it really is a trap. I think you hit the nail on the head with that, because you don't know what they mean by, moderate versus high. And we already struggle with those battles today.
We do. And I think one thing's going to play a role a lot differently in 2021 in E&M documentation is the time element. So right now, when you use time, you have to say 50% or more spent counseling or coordination of care to be able to use time. And you have to have that conversation of that counseling. Well, in 2021, time is going to be a factor if that's how you're going to, deal with your visit. But you could also put your practice at risk if you're a practice that sees 30 patients a day and you're saying every patient is a level 5. Well, do the math. It's still going to have to make sense that the time thresholds, which now isn't going to be about counseling, it's going to be about the total time of the visit, but you still have to make sense on the time thresholds. And I think that's going to be just really interesting. I hate to use the word nightmare, but I'm really thinking that that's going to be a red flag for practices to understand how that process works when incorporating time in 2021.
Most definitely. It just further necessitates the need for really great education. And I feel like our series, we've really taken all of the guesswork out of it.
We have, and that's a great way to put it. We're trying to give you a way for seamless transition and make sure that you can go from, okay, I know that they're going to give us everything we need, and we go from step 1 all the way to step 4, and then come 2021, you just walk into the role. I'm not saying you're not going to need periodic updates, but at least you have a way to know where your timeline starts and the process as we go forward. And what's really nice is that you're going to be able to, towards the last quarter of the year, know what you need to do to train your physicians. And we may repeat one of the how to level again, just as we get more information from Medicare and American Medical Association. So I think they're going to give us more information right as everybody's scrambling as well. So a lot of things that they like to give us last minute.
Absolutely. So thank you for putting this on everyone's radar and taking the time to join us today.
Well, I appreciate you having me, and thank you again.
Absolutely. To learn more about Terry, visit terryfletcher.net for more information. So it's time for this week's Coding Pro Tip, which is brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today. Visit projectresume.net and mention my code ALPHACODING for special pricing. If you have a coding related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. One of our listeners from Florida asked, my providers won't purchase new coding books each year. They always tell us that they're too expensive. What is your best advice for combating this issue? We're still using code books from 2017. Well, I definitely can appreciate your struggle because I've heard this same argument from providers I work with, and I always equate it to how providers are required to do CMEs and they're required to stay up to date on things that change and evolve in medicine. It's no different with coding. And so it's imperative that every single year you purchase those new books. Even if you just purchase one book per office, which I don't recommend, that's the bare minimum, you need to have the tools and the resources. So that would be like you being assigned to repair a roof, but you have no shingles, you have no tools to actually do so. So it doesn't make a whole lot of sense. I would go back to your providers and let them know that every single year there are hundreds of code changes, and it is going to cost you in the long run to be cheap in the short term. So it's really important to get those new code books. So if you like what you're hearing, hit that subscribe button now so you never miss another episode. And be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. I hope that Terry's pro tips will be useful to you as you plan for these major industry changes. Until next week, thank you for listening to Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.